Potencies discussion, page number 349.
Question. What is the explanation of antidoting high potencies by using lower ones? In tuberculosis, for instance, sulfur is occasionally too deep-acting, and a less similar remedy may work up to a stronger totality so that better results may be possible. Kent. The correspondence doctrine of series and degrees comes near the mastering the question of using potentization. The crude drug and the potentized remedy are opposite in action. Proving a remedy of one of the elements that exist in the body, sulfur for instance, helps make up the body. The prover takes crude sulfur until it produces a proving. He is unable then to appropriate it from the food to build up the body, being cloyed with it. The symptoms of sulfur patient indicate that he needs it, but she is not able to appropriate it from the food. Each resembles the other. Give the patient with the symptoms of sulfur the potency. If you give cruder, give it cruder, then it is in the natural body, etc. It only makes her worse. The higher potency of sulfur restores order, and she appropriates it from the food, not being fed enough to poison her. There are distinct degrees from the potency to the crude form according to the excitability of the patient. She reacts to the 200th, 500th, 1000th and so on, these being only illustrative. If a given remedy will make an individual react and appropriate that which is needed and help to appropriate from the blood that which is taken, the reaction may be to 5 m, and though not eaten, it is in the blood. Degrees are in sevens as an octaves of music. If you strike too high, she is not sensitive, it is not sufficient. Keep to the mild potency so long as it works. It is not well to jump too many degrees. From the crude to 10 m, there are a range of degrees in the ordinary person. You do not go from the first to the last in music. It does not preserve the chord. You take the thirds and fifths. మొట్టమొదటి మంత్రం దగ్గర నుంచి హయ్యెస్ట్కి వెళ్ళిపోవడం కాదు, మధ్యలో ఇంకా చాలా ఉన్నాయి మ్యూజిక్లో. అవన్నీ చేసుకుంటూ జాగ్రత్తగా వెళ్ళాలి. అలాగే క్రూడ్ దగ్గర నుంచి 10 mకో 50 mకో వెళ్ళిపోతాను కాబట్టి మధ్యలో కూడా చూసుకుని. You can repeat the series beginning with the lower potencies and do good work. The patient will recognize these series. Too high a potency gives an unnecessary aggravation and then will not perform the best curative action. The best action is the slight aggravation, as in the first few hours in the acute disorders. The ideal is the one that gives no aggravation but amelioration. We do not seek to produce an aggravation that is not the best, not the longest curative effect. No law is established for aggravations and ameliorations. Only by study of records and practical experience can we see the best action in patients. Question. Can you give too deep-acting potency to be curative? Would a less similar give safer results? Kent. The cruder approaches the opposite and antidotes. The low potencies approach in degrees to the higher potencies. In the sulfur patient who needed sulfur 10 or 20 years ago, and today it would kill her. Nux pulsatilla seniga palliate but cure. I have seen sulfur and phosphorus act so strongly that I have regretted it. In lung cases, consider whether she has lung space enough to make recovery probable. లంగ్ పూర్తిగా డ్యామేజ్ అయిపోయి కన్నం పడిపోయి బాగా ఇదైపోయిన తర్వాత అసలు రిపేర్కి వస్తే అక్కడ లంగ్లో అసలు స్పేస్ ఉందా లేదా అనేటువంటిది తెలుసుకుని ఎందుకు వాడికి అగ్రవేట్ చేసినందుకు చచ్చిపోతాడంటే ఇదే కారణం.
సల్ఫర్ maximum talent అనేది
సల్ఫర్ వేయకూడదు, టీబీ
maximum-గా కదా.
నచ్చడం. సల్ఫరు, ఫాస్ఫరస్, హెపార్ సల్ఫర్, సైలీషియా అది వేయకూడదు. ఇఫ్ షీ కెన్ బేర్ ఇట్, గివ్ ఇట్ ఇన్ ఏ లో పొటెన్సీ, but do not give it if there is not lung space enough to warrant it. Question. I have a mentally deficient child whose mind becomes clearer every time I advance in the plane. She has had barium sulfur. It is an unusual case. Would you go to the bottom and recommend the series or higher to MM? Kent. There you may be going into trouble and confusion. One patient may run up safely, but 99 cases would not have any action in those hypotensies. The object is to keep the patient under the influence of the remedy the longest time possible, to follow up with just enough difference to react, to reach the best acting plane. From experience, I am led to use a series from 1M to DM 5 cm, including 10M, somewhere near 50M and cm. Other potencies are given to observe what action is forthcoming. You encourage the patient to become oversensitive by using the highest potencies instead of going low to begin again. As a rule, 2 doses, sometimes 3 in the same plane, give the best results. It has become almost routine, as the records indicate that the 3rd dose in the same potency gives no effect. It is a mistake to mix degrees and the different makes. If Ellen Erhaft or Kent's has been started, stick to the same series and to the same scale. వాళ్ళ పొటెన్సీస్లో ఒకటి స్టార్ట్ చేస్తే దాన్ని అబ్జర్వ్ చేయమన్నా.